Hi everyone, my name is Jenny and I'm here with another video to discuss the importance about learning about your diabetes. Hopefully this video encourages you to watch our other videos where we talk about the specifics of lifestyle changes, different devices out there to help you monitor your blood glucose levels, and certain medications which I'll also discuss briefly in this video as well. And also check out other great videos made by more volunteers at Dr. Kearney's clinic. Okay, so why learn about your diabetes? By learning more about your diabetes and understanding insulin resistance, you will know what changes need to be made to reduce your risk of cardiac complications. I've been fortunate enough to help Dr. Curnew out during this COVID pandemic and asked him what his thoughts are on diabetes. So let's start with a few words from Dr. Curnew.
Okay, we're here at the clinic. What time is it? 8:35. I still have a couple more hours to go. Diabetes, unfortunately, is a predictor of bad things to happen to you. It doubles your mortality if you're not careful. So the first step is that the backbone is lifestyle changes. So you get information about the broad and the direct trial. Losing 20 pounds in the first few years of diabetes can put diabetes into remission. We know that women who get diabetes during pregnancy are more likely to have future diabetes later in life. So we need to work hard at this. When we make the diagnosis of sugar diabetes, that's a hemoglobin A1C of 6.5%, half the insulin producing cells unfortunately have passed away, the rest are working overtime. That's why weight reduction is so important. What you're going to see lots of information on lifestyle choices. They work, they're important, they're hard to do. I'm still trying to get my last 10 pounds down. Everybody in my family has diabetes except for myself because I'm working hard at prevention and I'm going to go down fighting, and it's not easy. So join the fight. We have a whole team of people to help you in this circumstance.
The DIRECT trial was a research study which investigated the offering of an intensive program for weight loss or weight loss maintenance, which would be advantageous for people with type 2 diabetes. So at 12 months, there was a weight loss of about 15 kilograms or more in 24% of the participants in the intervention group, but none in the control group, which did not have the intervention. Diabetes remission, just to clarify, is blood glucose levels which are healthy without needing to take any diabetes medications. This state of remission was achieved in 46% of the participants in the intervention group. So, just to sum up, at 12 months, almost half of the participants achieved remission to a non diabetic state and off their diabetes medications. So, this really just highlights the importance of making those lifestyle changes in order to make sure your blood glucose levels are at a healthy level.
So I'm going to take off my glasses so I can look 5 years younger. But actually, if I lose 10 pounds, my arteries will be 5 years younger. Um, I can't get a haircut right now because of the COVID scenario. I shave once a week, not today when I go into the hospital when I may have to wear an N95 mask. So I'm saying is, let's be healthier. I don't care about the color of your hair, how messy it is. I care about the inside, what your heart looks like, the vessels, the weight. Those are the things that determine outcome. And for many of us, we need to have some testing if necessary, but more importantly, the biggest test over here is how big your belly button is. Mine's too big. I'm working to be 10 pounds lighter. You do the same. Maybe 20 pounds for many of us or more. You can do it. We'll do it together.
The broad study, which Dr. Curnew had mentioned, is another great study which I think highlights the importance of diet, specifically for diabetes and weight loss. So it was a randomized control trial which used a whole food plant-based diet for communities for obesity, ischemic heart disease, or diabetes. And this program led to significant improvements in BMI, cholesterol, and other risk factors. This trial had such a great weight loss at 6 and at 12 months than any other trial, and it did not limit energy intake or mandate any regular exercise.
So I don't know what your dinner is, but mine's basically as many vegetables and beans as I can get into this. Cheers.
For those of you who've been convinced that weight loss is such an important factor in improving your health, try to think of ways to stay active during this quarantine. Go out for a walk with your family, walk your dog, maybe go out for a hike. Social distancing should not stop you from exercising. If you need more ideas on lifestyle changes for diet and exercise, please check out our second video where we discuss those in more detail.
Still, the best way of preventing a heart attack or stroke and diabetes is lowering your cholesterol. We know from the 1970s a trial called CARDS that you're going to see showing that low dose lipitor 10 milligrams a day lowers your risk of a heart attack or stroke by about 20 to 30%. High dose statin therapy, lipitor 80 milligrams a day or Crestor 40 milligrams a day, if you take it for 5 years or greater, will lower your risk of having a heart attack by 50% in the presence of diabetes or without diabetes. A backup pill called ezetimibe, 10 milligrams a day, lowers your risk even further by 10%. We have drugs by injection called PCSK9 drugs. They're very expensive drugs. I'm not saying you should be on them. They show additional value of preventing heart disease. So getting your LDL cholesterol very low is important to preventing a heart attack with or without diabetes.
The CARDS trial randomized around 2,300 patients with type 2 diabetes to receive lipitor 10 milligrams a day or placebo. And just to clarify, lipitor works to reduce your cholesterol levels. And in the graph shown here, you can see it did for median total cholesterol and LDL levels, which is your bad cholesterol. So in this trial, after 3.9 years of follow-up, lipitor did reduce the risk for coronary revascularization, stroke, and heart attacks by 37%. Therefore, lowering your cholesterol levels is another important factor to consider when you have diabetes or even in a pre-diabetic state. Cholesterol levels do need to be monitored and controlled.
We now realize that because of our preventive strategies, we're living longer, and the leading cause of death now in diabetes is congestive heart failure. So our initial approach is to lifestyle changes, medications to keep blood pressure under check, weight reduction, and now we have different medications of diabetes. And a very important class of medication is called SGLT2 receptor antagonists, which you're going to learn about. They help lower the weight a little bit by 5 to 10 pounds, but they also actually treat and prevent heart failure. You're also going to learn about medications called glucagon agonists. They're by injection. They lower the risk of having a heart attack or stroke by about 10 to 15%, but more importantly, they're associated with 10-pound weight reduction. Some of these medications are expensive. If they're too expensive, discuss that with your doctors and myself, because we have many options available to you. So what I'm saying is that diabetes affects multiple organ systems, affects the brain from stroke and dementia, affects the heart attacks, congestive heart failure, it affects the kidneys. And we now have good medication to help prevent kidney damage or delay that, as well as we use ACE-ARB therapy. But we also use these glucagon agonists that they're very protective as well. They affect the legs, peripheral vascular disease, blocked arteries. So there's so many steps that you can take. And you can see that everybody has an opinion on this. I'll share mine with you with our team. We have so many of our young people that are working hard, and I'm really proud of the work they've done. So take a look at this, join us. Let's make this a very important event.
For medications, please visit our first video where we speak about it in more detail. For now, I'll be speaking briefly about the medications, going over it in general terms, and then also go more in detail about the GLP-1 receptor agonist. We'll start with metformin, which is a first-line medication drug. It helps lower the amount of sugar that your liver releases into your blood, and then it also helps make it easier for your body to use insulin. Moving on, DPP-4 inhibitors act when sugar increases after a meal. It increases insulin levels, which help lower your blood sugar levels. And then it also decreases glucagon, and glucagon is a hormone that raises blood sugar levels. I've listed all the typical names here as well. Lastly, SGLT2 inhibitors reduce glucose levels in your body by increasing the amount of sugar that you pass in your urine, so you might find that you urinate a lot more frequently on this medication. If you've been at our clinic recently, you may recognize the drug Ozempic, and Ozempic is another diabetic drug which is injected, which can be used alone or in combination with other diabetes medications. And Ozempic is actually available through many private insurance plans, and it's also publicly reimbursed in Ontario for patients with type 2 diabetes, but otherwise a very expensive drug. It belongs to a class of drugs called glucagon like peptide 1 agonists or GLP-1 agonists, which act when sugars are higher than normal. And it does this by increasing insulin levels and decreasing glucagon levels. And it also slows the emptying of the stomach, so people find that they lose a lot of weight on this drug as well.
We now heard about COVID 19. COVID 19 by itself is a virus, doesn't kill you by itself. COVID 19 is associated with diseases. So if you have high blood pressure, you have diabetes, you have congestive heart failure, you have atrial fibrillation, you're overweight, you have hypertension, they all contribute. So let's actually work really hard at getting yourselves in the best shape possible. Um, because I don't know what the future holds, but I do know is that by being healthier, you feel better. And to me is that I'm going to be out in my bike in a safe environment exercising. I'm going to be here in the clinic and we're going to work with you. Some days I'm going to wear a mask. Right now I'm here in the clinic finishing off the work of the day. So join us, all our sessions here in the clinic in the future or on the internet. Let's work together and thank you so much. Thank Ginny and her team for putting together this work and also for their collaboration and their hard work on keeping you healthier. So they're happy to work with you. We all want to work together. It's not a job for one person, it's a team approach. Thank you, Ginny. Thank you and your team for doing all this.
So that concludes our video. Thank you guys for watching, and if you learned something new or you enjoyed this video, feel free to watch our other videos on our YouTube channel. And as well, visit us at our website, drcurnew.com, for more information, as well as subscribe to our newsletters.